Hey there, this is a tutorial on legs up the wall for pregnancy. So legs up the wall comes with many benefits. It boosts your circulation, it can reduce swelling in the legs and feet, it can relieve lower back pain, helps to relax the pelvic floor muscles, it can give you a boost of energy if you're feeling fatigued, and it can also help you calm down and relax if you're feeling a little hyped up or anxious. So many benefits to legs up the wall. Unfortunately, not every pregnant person feels comfortable in the traditional legs up the wall position. So I'm going to give you many variations of legs up the wall so you can find the one that works for you, or maybe a handful of them that work for you, so you'll know which one to go to when legs up the wall comes up into your class, or when you just need that moment of rest or maybe a little energy boost. So a few props that you might want to have close by: a wall, obviously, a bolster, a couple blocks, and a blanket. And this is just for kind of figuring out which variation of legs up the wall will work best for you. So let's start with the traditional variation. So you'll scoot your hips very close to the wall, which this part can be a little tricky in pregnancy because sometimes your belly kind of gets in the way. So I recommend coming onto your side, and then from your side, roll slowly to your back as you bring the legs up the wall. Now, one of the first things that you might notice when you bring your legs up the wall during pregnancy is that there's a lot more pressure coming to your head almost immediately because of all that extra blood flow. So really simple fix for that is to bring just a blanket or maybe a little pillow underneath the back of your head, and that should relieve that pressure in the head. Now, another thing that might be coming up for you is pain in the lower back, or a feeling that you can't breathe when you're flat on your back. So if that's the case, you might try taking a bolster underneath your hips. You'll press your arms down and press your feet against the wall to lift the hips up, and bring your bolster or blanket underneath the hips and see how that feels. Now, for some people, especially if you have SI pain, having the bolster under your hips is probably not the best placement. You might need to bring your bolster up a little higher so that the curve of your low back and that curve of your sacrum is matched by the bolster. So that might be the way that you feel most comfortable here. Now, if you can find one of these variations where you're on your back, maybe with the support of a bolster, maybe not, but you can find this place where you're comfortable with the legs up the wall, there are many variations you can take. You can have the legs really wide, getting a little more stretch for the inner thighs if that's a place that you often have tension or tightness. You can bring the bottoms of the feet together and the knees open wide in a bound angle variation. You can also bring your feet to the wall with your knees wide. This is really great if you have trouble with the squat position. It's a very important position for the delivery of your baby, so practicing with your feet on the wall and your back on the ground can help to open up some of the muscles that might prevent you from coming into the squat comfortably when you're on your feet. So a couple more variations. Let's take this bolster out from underneath the hips, and you can roll to your side if you're practicing along with me, and come up to a seat. Now, if you're not comfortable on your back, maybe because of SI joint pain or heartburn, or any other reason, maybe it doesn't feel like you can breathe well when you're on your back, you can try taking your legs up the wall with a little support underneath your back. So you can have your two blocks. One is going to be further away from you on its middle height. The one closer to you is going to be on its flattest side. And then your bolster will go on top of these blocks. So your bolster's at a nice incline. Now you want to have enough space between the edge of the bolster and the wall for your hips to nestle right in between them. So you can lean onto one side and then slowly roll onto your back. So your back is supported by the bolster, and your legs are able to be up the wall. So this is an ideal position for somebody that has both edema and heartburn. So this way you're getting the legs up to relieve the edema while still keeping your head and your heart higher than your hips to prevent the heartburn from getting any worse. And one more option I will show you today is maybe, let's say you're not comfortable with any of those other options, but you still want to get that leg relief. So you can use maybe just a blanket to go underneath your head, and you can come onto your side with your hips all the way against the wall, and you can take one leg up the wall, and you can rest here for maybe a minute or so, and when the time feels right, you can transition to the other side to take the other leg up the wall. So lots of ways to get your legs up the wall during pregnancy to get all of those many benefits of Viparita Karani. Thanks for joining me today. I hope you find one of those positions that works well for you.